Hi, I'm Dr. Michael Hyman from LACircumcision.com, and today I wanted to talk about how one chooses their doctor for performing this procedure. While I do have patients that come from all over the state of California, some people fly into Burbank Airport right here where I work. Others have taken the train, the Amtrak train, whether it's from San Diego. But for whatever reason, it may not necessarily be close enough for someone to do that, or it just may not be logistically possible for them. So I wanted to give you some tips about who performs this procedure and how you can choose the best possible doctor. One thing I want to clear up is what is a urologist and how do they differ from, say, other people who you might have heard that, doing this procedure, like a Moyle or even a family practitioner. A urologist, like me, is basically a surgeon. We've done our residency in two parts. One part is in a general surgery tract, where we do all kinds of operations like appendectomies and leg and vascular type procedures and intestinal operations like colostomies. And then we spend the rest of our years, usually 4 or 5 years, specifically doing urological surgery, whether that means operating on prostate glands or bladders, removing bladders, taking out kidneys and kidney stones, and what have you. And of course, we do procedures on external genitalia in men, particularly, of course, whether that means correctional procedures for penile disorders, testicular disorders, or in this case, circumcisions. So there are some other types of doctors and practitioners out there who do these procedures. One of the most common misperceptions is that Moyles are trained to do adult circumcisions. The reality is that Moyles do newborns. A Moyle, by the way, is a religious practitioner for religious circumcisions in Jews. And so they are trained to do it in a very special way that is consistent with the rules of that religious form of circumcision, as they would call it, the covenant, and the prayers that go along with it. But this is only in newborns. It's a completely different situation really after about 3 weeks, because the vasculature of the foreskin has changed dramatically at that point. And so you really can't do it in the method that they are trained to do it in. Once that 3 weeks is over and the newborn is over a month old, they really need to have it done in a more formal manner, and that's where urologists really come in. Incidentally, gynecologists are also trained to do circumcisions in newborns, but not in adults. And then lastly, I'll just mention family practitioners in some places in the country will get some training in circumcisions. My opinion is this is the type of procedure where it can look really easy and be really straightforward, or you can get into problems if you really don't know the ins and outs and the little hang-ups that can occur during the procedure. Sometimes there is tethering in certain places where you need to understand how to make your incisions and put things back together. What structures that you're going to need to avoid, for instance. If you think about the penis and you flip it up and look at the underside, you'll notice, for example, there's a ridge on the underside of your penis. That's the urethra. That's the tube that the urine goes through. And you really need to understand exactly where that lies underneath the skin, because you don't want to cut into that and enter that. Obviously, that would be a real problem, because then urine going through that tube could come through in the wrong place. You want it to come out of the opening. So these are just examples. When you're selecting your doctor, and like I said, I would recommend a urologist like myself, it's helpful to know what their background training is. Where did they train? Where did they graduate from medical school? Where did they complete their residency? In general, I think you can feel some confidence if certainly they've gone to an accredited American medical school. Now, some folks do train outside of the United States, and then they perform in some manner, either by testing or in additional training, medical school education here, and then take their board licensing exams. But really, those that are trained in the American universities are most adept when it comes to knowing the kinds of methodologies, medications, etc. that we use here. And then really looking at where they did their residency after medical school. That's basically where they were essentially an apprentice as a surgeon to really learn the techniques from people who know. And looking at the hospitals that they trained at, or the universities, which hospital and where, what affiliation, meaning which university that hospital was connected with, is it reputable? And you can look up a lot of the, sort of degree of reputation that those institutions have. And then lastly, looking at whether that urologist is board certified. So each urologist has to go through a board certification process after their residency, and you can look this up online, the American Board of Urology, and find out if that doctor is board certified. To me, that's really quite critical. Newer techniques, newer approaches, newer drugs, all of these things get lost if you do not maintain your board certification. So think carefully about these issues, because we're talking about an area where, as I said, it may seem like a real simple thing with just making a couple of incisions and putting stitches together. And like anything, whether it's repairing items in your house or your automobile or your body, it really matters that you have somebody not so much that can do it when it looks easy, but that can do it when it becomes hard. Because you never know if there's going to be surprises, and you want somebody who can deal with those surprises when they occur. Okay, if you have any questions, feel free to reach out. I can be reached through the website, lacircumcision.com. Take care.